And welcome back to the second hour of Kasie Dc. I'm Chris Jansing.
I'm Joshua Johnson. Tonight we have a sobering update on the status of coronavirus after the key people in charge of battling the pandemic announced a series of new steps and new warnings to an anxiety-ridden American public.
We will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today to process coronavirus tests.
We're going from somewhat manual, relatively slow phases to a testing regimen that we can test many tens of thousands to hundreds of thousands of individuals per week and maybe even more. We will have 1.9 million of these high throughput tests available this week, with numerous labs up to 2,000.
As these tests roll out over this next week, we will have a spike in our curve. We are going to see a spike as more and more people have access.
Has there been any talk, sir, of any sort of shutdown of domestic air travel at all?
Well, we continue to look at all options, and all options remain on the table to address.
To protect the American people, we'll consider anything and everything on the table. The worst is yet ahead for us. It is how we respond to that challenge that's going to determine what the ultimate endpoint is going to be.
We're going to all be great. We're going to be so good. Relax. We're doing great. It all will pass.
And the CDC is out with at least one brand new guideline this hour on limiting large gatherings. They say weddings, funerals, parades contribute to the spread of coronavirus. So they're recommending, at least for the next 8 weeks, all events of 50 people or more be canceled or postponed. The recommendation does not apply to places like schools or businesses. And with that, let's welcome our panel of experts in New York: virologist, epidemiologist, and MSNBC science contributor, Dr. Joseph Fair. In Seattle, pulmonologist, global health policy expert, and former pandemic policy consultant for the World Bank, Dr. Vin Gupta. And in St. Louis, chief medical officer of SSM Health and former chief medical officer of the Department of Homeland Security, Dr. Alexander Garza. So I want to just touch on what Anthony Fauci said. He said everything and anything is on the table. The worst is yet ahead. It's how we respond. When we look at a first response, Dr. Garza, and saying, well, let's limit at least gatherings to under 50 people, does that make sense to you?
It does. So one thing that we're trying to do is flatten the epidemic curve. And so what that means is if you look at the curve from China, it was very steep. And that's because the virus wasn't quite discovered yet. It was out in the community, very densely packed community. And what happened is it overran healthcare systems. So what we really want to do is flatten that curve so we don't have as many people getting sick at the same time.
But I guess the confusion for a lot of the American people is, if I'm in a group of people, what's the difference if I'm in the middle of 50 people or in the middle of 250 people, especially at a time when a lot of people who were on that stage with the president or in the briefing room with the president and vice president, we're talking about social distancing. We're talking about a lot of people staying home. We're seeing schools closed. We're seeing bars and restaurants closed. We're seeing major adjustments to the American way of life. Then this comes out 50 people or less. So is there a disconnect?
There's a little bit of a mixed message. So really what they're trying to emphasize is that you want to decrease the probability of being exposed to the virus, and the way that you do that is through social distancing. It does have a big impact on transmission. Now, there's no magic number, and so, you know, CDC picking 50, it'll probably ratchet down as the cases start to go up. But the whole idea behind it is to decrease transmission between people that have the virus and people that don't.
So where should we be at, Dr. Fair, in terms of the measures that are being taken? I mean, New York City schools just announced that they are preparing to shut down schools. Massachusetts is taking some similar steps, as was announced this evening. Is that where we need to be? Do we see states and cities taking steps that maybe the CDC should follow, or is the CDC generally in the right direction?
I think the states and cities are taking the lead, and they have to, because, again, there's been a lot of mixed messaging. They're leading because they have to. And I think that increasingly across the nation, we're going to see that. However, I must say that it's an all or none kind of problem at this point, because if we have spread in all 50 states, unless we all do that, it's just going to jump from one hotspot to another over time. So
we're going to get this set of guidelines tomorrow. Both Fauci and the vice president talked about this. They didn't want to give away too much, although they seem to indicate it may be recommendations for closing bars and restaurants. I'd like to hear from all of you, if I can, knowing what you know about where we are now and obviously where we want to be. What should those guidelines include? Dr. Gupta.
Well, I think Ohio has been a leader on this, and I have to praise Governor DeWine for going ahead and shutting down bars and restaurants as of 9 p.m. today, because
should that be national?
I think so. I think compelling people to do it through recommendation doesn't seem like it's been working, and we should be doing it via decree. And really, the emphasis here should be on social distancing, flattening the curve, so that asymptomatic transmitters, we know they exist, we know that they are going to be the vessel in which this disease continues to transmit and put at significant risk to the health of people with pre-existing conditions. So my concern here, and I know everybody in public health really shares this, is how do we minimize that transmission risk? It's not the 65 and older crowd that's transmitting this disease going out and about. It's the younger demographics. And so I think if they're not following recommendations, we should move towards compelling.
Dr. Fair, what should be in that set of recommendations tomorrow?
I completely agree with Dr. Gupta, and I think, you know, what happened in Italy, what happened in France, what happened in Spain, we're seeing that same trajectory, and I think we're going to see exactly the same thing here. Social distancing is social distancing, so you can't say 50 people or less. It has to be, you have to be distanced socially from others that you don't have daily contact with or necessarily have to have daily contact with.
Dr. Garza, the news that there are going to be 1.9 million new test kits available starting tomorrow. What's your take on the impact that will have? 1.9 million sounds like a lot. We are a nation of 340 million, so it's not nothing, but, you know, 340 million. How do you see the impact that'll have?
Yeah, it's sort of a drop in the bucket, really. If we looked at the testing that we're doing today, we haven't done nearly as much testing as a country than a lot of other countries have done.
Is the U.S. doing anything right, Dr. Garza? I mean, I know that sounds like a facetious question. I know it sounds like I'm being flip, but God almighty, all I hear is about what the U.S. is screwing up and screwing up and screwing up and screwing up. Are we doing anything right?
Well, so you know, I know a lot of people at the CDC. They're all good people, and they're working hard. They have faced a lot of challenges, and you've mentioned a couple of those with getting the policy right, you know, getting those test kits out. And it doesn't help when you're having this mixed messages coming from the administration. And so that creates a lot of anxiety because people want to have information. And if you're not providing, you know, that robust information, they're going to start filling that narrative in. You know, half of this is a clinical problem or a medical problem, and half of it really is a communication problem as well.
Could I interrupt you for just a second and get your reaction to something? Because this is a congressman from the state of California by the name of Devin Nunes, and this is what he is telling people.
There's a lot of concerns with the economy here because people are scared to go out. But I will just say, one of the things you can do if you're healthy, you and your family, it's a great time to just go out, go to a local restaurant. Yeah. Likely you can get in easily. You know, let's not hurt the working people in this country that are relying on wages and tips to keep their small business going.
You know, we're very sympathetic.
Don't run to the.
Understood.
Yeah, just don't run to the grocery store and buy you know, $4,000 of food.
Right, they're cleaning off the shelves.
Go to your local pub.
Is that useful?
No, I would say we need to follow the science and the best advice of our public health practitioners, which is practicing social distancing. We know that it's really hard to make up time if we're not very aggressive with doing social distancing policy. And so every day that we wait to implement these measures, that curve is going to start growing exponentially of the number of cases that are out there.
Dr. Fair, Italy just announced 386 deaths in a single day.
Jeez.
This is not Sierra Leone during Ebola. This is not a third world country. And you know all too well exactly what those kinds of contagions can do in more impoverished and struggling parts of the world. What do you make of that? And what does that tell us about what we should be watching for here in the U.S.?
Italy has the same exact problems we do in that they did not have enough intensive care beds. They did not have enough ventilators. Yes, they had an elderly population, but we too have an elderly population. I should also mention they have much healthier lifestyles than we have here in the United States.
Mediterranean
so
diet,
we lead the
etc.
world
Yep.
in diabetes and all of the other high-risk conditions. So we don't have enough ventilators. We don't have enough beds. We lead the world in high-risk conditions. So I think arguably we could expect worse. And I don't mean that in fear-mongering, because, again, 80% should be fine. But what about that 15 to 20% that's not going to be? That's a lot of people in a country our size.
Now, clarify enough. Is the gap like this, or is the gap like this? Or, like, give me some perspective for how far off we are.
I can't speak to the specific numbers of how many we're going to need, but based on the projections of how many people would need ventilators, if you're just looking at 15 to 20%, we have a fraction of the number of beds and ventilators that we would need to care for those patients,
So
the critically ill.
Dr. Gupta, a lot of us looked at the pictures over the last 16, 18 hours or so at airports. People packed in like sardines after coming off planes, which many of them had been on for 8 and 10 hours and longer. And then they're waiting 3 or 4 hours in line on top of each other that many of them reported they went through with folks who did not have gloves on. They were not asked questions. No temperatures were obviously taken. This is a picture last night from O'Hare International Airport. And one of the questions that I've seen out there a lot is, wow, if I was stuck in this for 4 or 5 hours, do I need to self-quarantine? I don't know who was next to me.
It's a great point you bring up, Chris, and it's a challenge here because, again, it goes back to this repetitive mixed messaging in terms of what we're advocating for, what we're seeing in terms of reality. Truth is, we're advocating for droplet precautions in the setting of COVID-19, which means
I don't see anybody in this video who has a mask on or any sort of protective gear. Why would they, right?
Sure, and that's the challenge here, and you're raising a really important point. Would I recommend that everybody go into self-quarantine? It's such a tough question. I think if they're feeling symptomatic, cough, fever, those are the 2 main symptoms of anybody that we're really thinking has a high pretest probability of this disease, then sure, I think it's the better part of valor to go into self-quarantine. If not, then I think you just have to make yourself aware, bring yourself to attention, medical attention, if symptoms do arise, because we know that there's an incubation period. If there was an exposure, it takes about 4 days. And then bring yourself to attention. But I think it's just vigilance at this point amongst those who are stuck, unfortunately, in the airports.
Hey, Dr. Gupta, can I stick with you for a minute? What is Seattle doing? What is Washington State doing right that you think the rest of the country should learn from? Is there one thing at the top of the list?
I think Governor Inslee has been a paradigm of excellence here, and as has been his entire administration. This is challenging. Any pandemic response is challenging because you're dealing with a threat you can't see. We're all talking about rapid diagnostics as though we can just build a PCR platform immediately and we can predict what that sequence of that virus is.
PCR, that's a method of kind of sequencing what something is based on the DNA in it, right?
You got it. You got it. And so in the setting of so much unknown, uncertainty, I think we've taken, the governor has taken a lot of aggressive actions that are evidence-based. He's led the country in terms of social distancing. And I think that's been great. He's working with the public sector, with the private sector, with academic institutions to try to bring a whole of government, whole of society approach to increased testing, for example. And so I think he's done the right thing on several different initiatives, and we're dealing with a real crisis here, but I think his leadership's been extraordinary.
So just to comment on the testing as well, you know, the PCR test, it's a formula, it's a recipe, and it tells you if you are acutely ill with the virus, and that's the standard test that we're going to be using for everyone. Labs are just like any other business. If you've already got a backlog and you've got hundreds of thousands of cases coming in, it's going to take time to work through all of those cases, and that means every lab in the United States should probably have this test and be able to run this test. So it's still going to take time, and they're going to be working 24/7.
And PCR is not a fast test. Like I've done PCRs before.
Yeah.
Some of them are fast, and some of them take a while.
It runs a couple of hours, but keep in mind if you got 10,000 cases per day, et cetera, it's going to take a long time to get your results back, longer than you would like. I should also mention, while we're just now harnessing the power of the commercial sector, we've not even harnessed the full power of the governmental sector. The Department of Defense has its own resources to produce PCR assays. We use them all over Africa for Ebola. Very few people know that, but most of the assays came from the DOD, not the CDC in that aspect. So Department of Defense, CDC, commercial sector, and it's a formula. It's not a patented formula. So we should distribute that to everyone that has pharma-grade manufacturing capability, produce as much as possible, and get them out to every lab possible in the United States now.
That is such a great point. The U.S. military response to Ebola in West Africa was extraordinary, saved thousands, if not tens of thousands of lives. Why can't we do that here? Dr. Fair, thank you. Drs. Gupta and Garza, thanks to you as well. Former House Speaker Newt Gingrich is issuing a dire new warning about the coronavirus outbreak. He wrote an op-ed about what he's seeing in Italy, where his wife is the U.S. ambassador to the Vatican.
In it, he writes, quote, "Faced with a pandemic threat, history teaches us it is far better to be over-prepared than under-prepared." He goes on to write, quote, "If America begins to have the Italian scale of deaths, we would be losing 5,000, 10 or 15,000 Americans. If it really got out of control, the rates could go higher," unquote.
And Gingrich isn't the only one issuing that sort of warning. Former Obama official Andy Slavitt, the former acting administrator for the Centers for Medicare and Medicaid Services, warned that by March 23rd, just over a week from now, many of our largest cities and hospitals are on course to be overrun with cases. And joining us now from Minneapolis is Andy Slavitt. Thank you so much. You write, the best course of action to prevent the U.S. from becoming Italy is to socially isolate. You're writing this just as the CDC is saying stop any kind of gathering that's 50 people or more. Tell us, in your mind, what needs to be done and what social isolation means.
Sure. Well, thank you for having me on, Chris. Really, it's hashtag stay home. I think that is the message that everybody needs to get. Many Americans are understanding this message. Many younger people aren't. Many people in their 20s and their teens, with St. Patrick's Day approaching, aren't getting that message. And the truth of the matter is, at this point in time, the only way we can prevent the number of cases from overwhelming the healthcare system in ways that your other guests have described, in the ways that have happened in Italy, is if we ourselves do this. So there's a lot of focus on the government, the Trump administration, the governors, mayors, they all have really important roles to play. But the most important thing we can do is hashtag stay home. And by doing that, you're not just going to keep yourself healthier. More importantly, you're going to not spread the coronavirus to other people, and particularly other people who may be in worse physical condition than you think you are. So we've just 15 healthcare leaders and myself just published an op-ed in the USA Today that we're sending to every governor and mayor in the country, and it's an open letter to every American with a series of about 30 recommendations on what stay home means.
You tweeted that experts are expecting more than 1 million deaths in the United States. Right now, by our count, we're at 67. How do we get from 67 to 1 million? Where does that number come from?
Sure. Well, Dr. Fauci, I think, was asked this question in congressional testimony, and I think he said it best. He said, if we don't act to change the course of how we respond to the virus, there could be millions and millions of people who lose their lives. That's Dr. Fauci, who I think is probably the most authoritative voice on this topic. But the most important thing he also said was that those numbers are not our destiny. And I think if you look in the following tweets that I made that are immediately following that one, we talk about the number of things that we can still do, and this is very good news because our destiny is in our hands, to dramatically lower that number. And those really are the things that we're talking about and that others are talking about, just much more aggressively staying home and riding this thing out. And I think if we do that, we are going to see a much better outcome. If we don't, then I think the warnings we're hearing from Italy, people on the ground in Seattle are telling us that we are walking into something that could be quite severe. And the numbers, as we all know, any number is too many. Any avoidable death we need to avoid. So I don't think it matters, and I don't think it's important to focus on the scale of this thing. It's important to focus on what can we do about it. and the fact that the stakes are so high.
So how much do you think the mixed messaging is contributing and could contribute to where this goes in terms of the number of cases and the number of deaths? I'm thinking right now, we just a short time ago played California Congressman Devin Nunes saying, go out to bars, we need it for the economy. Conversely, AOC, Alexandria Ocasio-Cortez, tweeted, and she has a lot of young followers, and she said to her, especially people under 40, please, capital letters, stop crowding bars, restaurants, and public spaces right now. Eat your meals at home. But all these mixed messages are coming out there.
Right. First, let's just posit that this isn't about Democrat or Republican. It's not even about American. It's about the entire world. It's about our species. So this is not a comment reflective of Congressperson Nunes or Congressperson AOC, but I would say find your own trusted sources. The health department in your state, in your city, people you believe, people you can trust, people who you follow. And listen to them. What I would say is that we've been a bit behind from the federal government on down. We've been sort of chasing this problem instead of getting ahead of it. And getting ahead of it now really means that as this thing comes into your community, and remember, this is in New York in a big way now. It's in Boston in a big way. But there are other communities in this country where it isn't yet. And so if I were in a city in the country that had no communication, no community spread yet, I might take Congressman Nunes' advice, have dinner, not because I want to promote the economy. I don't think that's the right message, but I think, live your life. But as soon as in your location, the public health officials tell you that the number of community cases is spreading, then if they don't shut the bars and restaurants down for you, you need to be shutting them down yourselves. And in my opinion, to keep it simple, this is a period of time. It's going to be a period of time in our lives. We're always going to remember it. It's going to be a short period of time. Stay home. Hashtag stay home. You will save lives.
Andy Slavitt, thank you so much. And when we return, even more breaking news. We're just getting word of the first presumptive coronavirus case for a sailor on board a U.S. Navy ship. That's next. We have some breaking news right now. A first during this pandemic. A U.S. sailor aboard the USS Boxer has tested presumptive positive for coronavirus. Joining us on the phone, Colonel Jack Jacobs. Colonel, it's first of all obviously concerning because tight quarters, a lot of people on the ship, could spread. But you and I just had a conversation about this, I don't know, a week, 10 days ago. There are also operational and potentially national security concerns. Tell us what it means if someone on board a Navy ship tests positive for coronavirus.
Well, we don't know where the sailor's been, and of course we have something like 1.3 million Americans who are in uniform on active duty right now, and they're all over the place. Many of them have been on leave or on pass, and many of them in foreign countries, so it's very easy to pick something up and bring it back. I'm shocked that there's only one so far. There are two things about this. The first is this person is going to be quarantined. It's very easy to quarantine somebody in the military establishment, much easier than it is among civilians. The second thing is that these are all young people, and so the possibility of there being long-term deleterious results of this on individuals is low. However, as you said, these are all young people who are defending the country, and any kind of situation like this is going to have a really bad impact on our ability to defend our interests worldwide. We've already canceled, I don't know how many joint and combined exercises overseas, in Korea, in the Baltic states, with Norway, and so on. And we have to have these things in order to test all of our systems.
Well, you were also explaining to me, Jack, that on some of these ships, there are only a couple of people who do certain critical jobs.
Yeah, for those services, the Air Force and the Navy in particular, that are equipment-centric, at some juncture, you can't run the operation at all. If a sufficient number of people in military occupational specialties that are critical to the operation of the ship or the aircraft wing become sick, you can't run the operation at all because they can't be easily replaced. That is the big danger for these operational systems.
Well, we don't know a lot about this particular person or what their job was, but it's important to put it in context, the concern that all of us have. Colonel Jack Jacobs, thank you so much. We appreciate you calling in.
You're welcome, Chris.
Also worth noting, just based on the statement from the Navy, that the people that this individual did have immediate contact with are also in self-isolation. None of them is aboard ship currently, and of course, this is presumptive positive pending confirmation from the CDC. We'll keep an eye on that story. But for now, let's get back to the mainstream of politics and the coronavirus. Now, during his Oval Office address on Thursday night, President Trump said we must put politics aside. That statement does not exactly square with his repeated attacks on the Obama administration throughout this crisis.
The Obama administration made a decision on testing that turned out to be very detrimental to what we're doing, and we undid that decision a few days ago. We had to change things that were done, that were nobody's fault. Perhaps they wanted to do something a different way, but it was a much slower process from a previous administration. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted. If you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late.
Joining us now from Washington, Julie Rovner, the chief Washington correspondent for Kaiser Health News, Matt Gorman, former communications director for the National Republican Congressional Committee, and in Philadelphia, Aaron Haynes, editor-at-large for The 19th, a nonprofit newsroom focused on gender and politics. Good to see all three of you. Aaron, let me start with you. The president took a significant amount of his time to attack the press over a website that Google is in the middle of developing that would only be available to some people in California. Today, during his briefing, he mentioned that he was correct in terms of his account of what had happened. That's not quite right, but that just kind of seems to feed all of the politics around what I think we would like to just have be a public health situation that we could just focus on keeping people well.
Exactly. Good to be with you, Joshua, or at least with you from a distance. Yeah, and the dissonance, you know, that is coming from the president, the officials in his administration, and medical professionals is confusing to the American people, and really does kind of underscore the turn that we have taken, you know, as a country and in our politics just in the past week. I mean, the fear election has definitely taken on a different dimension. And you heard even Senator Sanders say in the opening of the first debate that is happening since the pandemic that, you know, what he is saying is that President Trump just needs to shut up because, you know, what he is saying to the American people is not, you know, it's confusing them more than it is comforting them in this moment. And so, you know, I think, you know, the moment that we find ourselves in now in our politics is that, you know, questions of electability are on the table, and who is best equipped to make the Americans feel safe in the midst of this crisis. And so, you know, whether that is President Trump, Vice President Biden, or Senator Sanders is really the question now that voters are looking to try to find an answer to.
Matt, I think Aaron is absolutely right about that, but a lot of people could get sick and die between now and November when the American people have a chance to vote how they feel about leadership. In the meantime, I mean, we always, in a time of crisis, we have wanted to believe and have most often, I think, in modern times, seen the American people coming together. But we're in a different environment now. We saw it with the NBC poll about people's approval rating of how the president is handling this. It seemed to split down exactly the way by party and the way the president's approval rating does. What do you see, if anything? Is there anything that folks in Washington can do now to come together and lead? How do we get out of this? We're in a period of life and death.
No, look, I think you're right. And this is not the first time something like this has been politicized. And I think certainly President Trump taking the shot to the Obama administration, you have a Democratic super PAC running ads against Republican senators on coronavirus. I think you're absolutely right. I also think, though, broadly, this reminds me of the BP oil spill or the Iranian hostage crisis. And what I mean by that is the president didn't create this crisis, and he really can't control it day to day. He just simply has to manage it. And I think that's a huge worry for many Republicans I talk to, because this is the potential politically to spiral very quickly against President Trump and his administration. And I think in some respects, this is a potential to be an existential threat to the Trump presidency.
Does it have the potential to turn some of these Republican members of Congress into people who think for themselves? In other words, finally put aside their concerns that the president is going to tweet against them, but really talk about what is most important for their constituents and what needs to be done to save lives.
Well, frankly, I'm not really sure what you mean by that.
Well, what I mean is that we know that in a lot of circumstances, we have heard that behind the scenes, Republicans have been upset about things the president has said or done, but won't talk about it publicly because they're concerned about the impact it would have if he tweeted against them. We've seen sometimes what the impact has been. But is this a time when members of his own party need to step up?
Well, I think for the most part, as we saw with the coronavirus vote, only 40 folks of both parties voted against that bill. You have Steve Mnuchin and Nancy Pelosi agreeing on that. I think you're going to see a high number of folks from both parties in the Senate vote for that bill when it gets over there later this week. I don't think really a tweet has anything to do with this. If you notice, he really hasn't been attacking members of Congress through this crisis. I think large part we've seen, at least on Capitol Hill, some fairly good cooperation. They were able to get a deal done last week.
Julie, before we have to move on, give us a sense of where we stand policy-wise. You're one of my favorite people to talk health policy with. How much of this do you think is going to be easy, that both sides pretty much agree on? And how much of this constitutes the sticking points in terms of whatever has to happen policy-wise going forward?
Well, there's so much distrust in the government between Democrats and Republicans right now. I covered Capitol Hill after 9/11 and the anthrax attacks, and there was an enormous amount of bipartisan, we have to do this for the country. Right now, everybody is doubtful of everybody else's, ideas. The Republicans say the Democrats want to expand the welfare state too much. The Democrats say the Republicans don't believe in public health. They have reached a deal so far, but they all know that more will have to come. This is a big shock to the economy. And plus, there's this continuing concern, as you've been talking about all week, really, about the possibility of swamping the healthcare system.
Julie Rovner, Matt Gorman, and Aaron Haynes, thanks very much for talking to us. When we come back,
guys.
The House stretches late into the night to pass emergency coronavirus funding, while the Senate takes a 3-day weekend.
Congressman Tim Ryan and Raul Ruiz will both join us next.
We thought it would be important to show the American people, to assure the American people that we are willing and able to work together.
We have a better product today because we waited, we looked at it, and we worked together.
A rare show of bipartisanship, the House passing a coronavirus relief bill this weekend, providing financial assistance to those affected by the pandemic. But the measure, which aims to mitigate the economic impact of the virus, only covers sick leave for about 20% of American workers.
That's right. Large corporations with more than 500 employees are exempt. Companies with fewer than 50 workers could seek hardship exemptions. That bill now moves on to the Senate. Joining us now is Democratic Congressman Tim Ryan of Ohio. This week he proposed an emergency earned income tax credit. And Democratic Congressman Raul Ruiz of California. He worked as an ER doctor before joining Congress. Gentlemen, thanks for making time for us tonight.
It's good to be here. Thank you.
So we talked about the loopholes in the coronavirus relief bill. Why not pass a measure that requires all employers to provide sick leave? Congressman Ruiz, I've heard a number of different cases as to why this is necessary, that some larger employers are going to provide sick leave anyway. We got a statement from Steve Wynn's casinos in Las Vegas saying that his workers are going to remain on full paid leave while they are closed down. So is this something that we actually need, or can we leave it to some larger companies to do the right thing?
Well, first of all, about 89 to 90% of these large corporations already provide paid sick leave. This focuses on those companies that need it the most and those workers that don't have the protections in those companies that need them the most. Second of all, keep in mind that paid sick leave is one component of making sure that workers have the ability to stay home and to take care of their families. The extra protections within the Family Medical Leave Act is another component. The extended unemployment insurance is the third component. So all of these put together is a robust way to ensure that the American people can follow the CDC guidelines, take care of the families, and do what's necessary to stay safe and stay healthy.
So, Congressman Ryan, what do you think about the extent of how much this will help? I know that you're interested in the earned income tax credit proposal.
Well, this is a first step, and if you see in Ohio, for example, Governor DeWine said that all the bars and restaurants are going to be closed in this state as of 9 o'clock tonight. Within just a few minutes, which I support 1,000%. What we did Saturday morning is a first step. We need a cash infusion into the workers in the United States. That closing bars and restaurants going to have a ripple effect with all those workers there. We're going to need to take steps for small businesses, significant steps around capital. I mean, how are these businesses going to survive? Even the larger companies who are going to be closing down, you know, how do we figure out how to help them as well? We are in a depression-style government, and the federal government is not acting that way. The Senate is not acting that way. The House obviously stands ready to do this, but this was a very modest first step. We were getting fought the whole time on the paid leave. That's why the vote ended up being from Thursday to Friday to 1 a.m. Saturday morning, because we were getting pushback from the Republicans on it.
Congressman Ruiz, talk about what's happening in your district with regards to coronavirus and how it's being dealt with in the federal government. You represent California's 36th district, which includes Palm Springs, Palm Desert, makes its way east pretty much to the Arizona state line. Correct. It looks like. So you've got a blend of all kinds of people, a lot of seniors in the Palm Springs, Palm Desert area. How is all of this affecting your constituents?
Well, as you can see from the background, we live in a very beautiful environment that's a retirement community. The vast majority are over 55 years old, and so these are individuals who are at higher risk of getting severely ill. We've already had 12 cases. Many of them were community acquired, and we're taking measures to limit the time that the seniors spend outside. Palm Springs declared an emergency declaration. The county has declared an emergency declaration. It's very important that we look out for another. And let me tell you something. Our constituents, the residents who live here are very anxious. They're anxious because there's no leadership from the White House with consistent messaging, because they're contradicting the scientists, and that needs to end. It's just, you look at the difference between President Trump's press conference and Vice President Joe Biden's press conference, and their plans and their demeanor and their straightforwardness with the American people. And that's why, in fact, I've decided to endorse Vice President Joe Biden for the presidency. So I've taken upon myself to pick up the slack and do a Facebook, social media video to help educate the people, to do live Facebook Q&A as a physician, public health expert trained in disaster aid, and to work closely with the local community to create a system, at least here, that we can inform the public to make plans to mitigate its effect. We can do it if we focus, if we get consistent, clear message, and if we take proper actions to protect those that are most likely or at risk of getting severely sick. We can do this.
But there's another effect, I think, in Palm Springs, Palm Desert especially, that people might suffer, and that's economic. I mean, it's a tourist economy in large part, and I can think of a lot of people that I know who live and work in Palm Springs who could end up taking a hell of a haircut if things stay closed for very long. Even though it might be the right thing to do from a public health standpoint, their livelihood depends on this.
Well, see, it's very important to understand that we will never stabilize the economy if we don't put an end and address the public health. We first need to make sure that our workers and consumers stay healthy or get healthy as soon as possible. Otherwise, the economy will be prolonged. The instability of the economy will be prolonged. That's why we have to focus on the public health effects first. Now, this bill that we just passed, the Family First Recovery Act, does have tax credits it's for the self-employed as well as small businesses who comply with all the worker protections that we give. So there is some protections. Now, this isn't the end all. This, we don't know how severe this will get, although it will become very severe, and there will be more opportunities to address the economic turmoil that that this coronavirus outbreak is going to inflict on different communities.
So, Congressman Ryan, you live in a state where there's some of the best health care in the world, frankly. The Cleveland Clinic already has started testing, drive-through testing. I think they did it yesterday. Tomorrow, university hospitals are going to do it. Couple of questions. What are you hearing about how that's working? But what are you also hearing from the hospitals around you about some of the concerns we've heard? If there's a shortage of beds, a shortage of equipment, what are they telling you?
Well, it's one of those situations where we're very blessed to have the Cleveland Clinic and University, and I think the University of Cincinnati starting to produce their own tests because the federal government, it was a woefully, attempt to try to get us where we needed to be as far as testing. We're, weeks and weeks behind because the president said this was a hoax and we were in denial. So, of course, we're going to be behind on these things. So we're lucky to have them. They're not at the level we want, and we don't have enough tests that we need here in Ohio. And as Governor DeWine said, we think there may be over 100,000 people who would test positive, but we don't have the tests. So putting this in place with the drive-through, drive-by testing, I think is really, really important, but also having the tests available at the level we need to be able to stop this is really, really important. But quickly, what you were talking about in Congressman Ruiz's, Dr. Ruiz's district, it's that cash infusion. I have a bill that will give up to $6,000, me and Congressman Ro Khanna, to people who make less than $100,000 a year. This covers 2/3 of the workers in the United States. So when the banks went under, however many years ago, we bailed out the banks. What we're saying is let's get money in the pockets of working class people, these waitresses, these waiters, these manufacturers, people who take a shower after work, not just before work. They need help. And that's what this bill is going to do. And so if we're going to come back to Congress, I think this needs to be an essential component of making sure we soften the blow for these people. The federal government has already let them down because their lack of response to the coronavirus in the first place. Let's make sure they don't suffer economically as well.
Congressman Tim Ryan and Raul Ruiz, gentlemen, thanks very much. We're back in a minute. Stay close.
Thank you.
Thank you.
That's going to do it for us tonight on Kasie Dc, but stay with MSNBC because we've got a post-debate special hosted by Lawrence O'Donnell.
Chris and I are back tomorrow at 1 p.m. Eastern to answer more of your questions on coronavirus. We're looking forward to it. But until we meet again, go wash your hands, 20 seconds, and good night from New York.
Good night.